Now we're going to have Dr. Amrapali Patil, MBBS, MD Pharmacology, MBA, Director of the Vedicure Group of Companies, Founder CEO of Trim and Tone, Weight Management and Wellness Clinic in Mumbai. And Dr. Patil will talk about a new approach for the treatment of obesity, Integrated Medical Weight Management Program.
Thank you so much, sir. Good evening, everybody. I know we are running out of time. I'm going to make this very snappy and jiffy. So you must be wondering what a pharmacologist is doing here. Well, I have studied in an institution, which is KEM Hospital, and my doctor, Dr. Sharadini Dahanukar, has been my teacher. She was the first person who put up an Ayurvedic research center in an allopathic institution. So I guess the sanskara started from that time. And when I married, the entire environment in my household was very Ayurvedic, and that's how I got influenced. During the course of my clinical practice, I noticed that a lot of issues develop due to obesity and overweight, being overweight. So that's the reason why I thought that we must have an approach, a new approach towards obesity. That's the WHO definition over there. What's overweight and what is being obese? Well, as simple as that, excessive weight that may impair health is called as being overweight or obese. And the parameter which is used is the body mass index, the various categories which have been mentioned over here and which segregate the patients into different categories of obesity are. For normal people, the body mass index, BMI, is between 18 to 24.9. For people who are categorized as overweight people, it's between 25 to 29.9. And people who are obese, they have the BMI of 30 or even more than that. Greater than this is the category of morbidly obese people. WHO calls this as a global problem. In fact, it has coined a term for it called as globesity. 2.3 billion overweight adults and more than 700 million of them are obese across the globe. That's the latest report from WHO. It's just not a cosmetic issue anymore. We've got to look at obesity and being overweight as a medical problem so that people take this seriously. WHO calls obesity or being overweight as the most serious medical disorder of this particular century. We know the implications and complications of obesity are too many. People who are obese and overweight suffer from gallstones, diabetes mellitus, hypertension, so on and so forth. What are the pain points right now? What is the gap in therapy? The patients need authentic medical obesity consultants. Somebody sometime back, one of the eminent speakers, spoke about the connection between the primary healthcare physician or the family physician and the patient. I appreciate that. But with obesity, we have to go a little further than that. We've got to have dedicated professionals, medical professionals, who can behave and act and function like proper obesity consultants. So currently, we don't have authentic obesity consultants. Most of the times, medical screening is not conducted, and obesity is considered just as a cosmetic issue, and some kind of remedies or therapies are suggested. I emphasize one more time, it's not just a cosmetic issue, it's a medical problem too. There's a lack of genuine medical intervention and supervision of weight loss programs. Patients need scientific, safe, non-invasive weight loss programs which are efficacious too. There is no one-stop solution currently available, and that brings us clearly into what are the currently available therapies and what are their limitations. We know that surgery is an option, but it's an invasive procedure. Hey, if I have to ask you how many of you would want to opt for surgery, I'm sure you'd want to look for something which is more non-invasive. Bariatric surgery, gastric stapling, balloon implantation, so on and so forth, they come with their own side effects of the surgery per se and the anesthesia and the operation theater catastrophes which can take place during such procedures. So people and patients generally don't offer these kinds of procedures. Well, non-invasive procedures are the allopathic medications which come with a host of side effects. Some of them cause psychiatric problem, and they themselves can cause suicidal tendencies, leave alone obesity and being overweight. Some of them cause cardiovascular problems which are so serious and they can be fatal at times. And most of them sort of don't help the patient. Yet there are some more which cause irreversible hepatitis and liver damage. So it's about time we looked at something which is much more holistic. And obesity is a multi-pronged disease. It can result due to endogenous, exogenous factors. It can be due to genetic factors. It can be due to other medical coexisting comorbid conditions. So we've got to look at something which is much more safe, which is less invasive or less or something that is non-invasive, and that brings us neatly to what I have called as integrated medical weight loss program. Integrated medical weight loss program is a scientific blend of the wisdom of ancient medical sciences such as Ayurveda, acupuncture, which was called as Marmaveda or Suchi Veda, and yoga, etc., along with the modern scientific technologies such as high-intensity focused ultrasonic lipolysis along with radio frequency. This is a holistic and integrated approach, and we've been speaking a lot since morning about how we should be less reductionist. Actually, we should not be a reductionist, and how we should be more integrated and more holistic. I'm sure we would all appreciate this particular fact. So with this particular approach, the patient gets the best of both the worlds. And what exactly is this particular program composed of? Right at the outset, the patients are told that this is just not a cosmetic issue, it's a medical issue, and we've got to look into your lab investigations, your biochemical parameters. So a medical screening is conducted at the outset, all throughout the program, and at the end of the program. And these are compared, and the results are compared and seen that there are changes in these. Also the body composition analysis, which is made up of the BMI, BMR, the fat percent, visceral fat percent, etc. All of this is analyzed, and so the patient as well as the doctor gets to know that, hey, yeah, there's a definite improvement over there. Well, the individual, I promised I'm going to make it jiffy. The individual components, like I told earlier, is Ayurveda, kapha reduction. And for this, we have various kinds of herbs such as amla, bibitaki, haritaki, gugul, etc. And then we have other therapeutic procedures such as lekhan basti, udvartan, etc. Acupuncture, traditional Chinese medicine, or Suchi Veda or Marmabhedan. The typical mechanism of acupuncture is homeostasis and bringing body to normalcy, releasing the feel-good hormones, endorphins, which bring down the stress levels, also reducing the level of cortisol, which is the stress-inducing hormone, and also functioning in line, in sync with the obesity hormones, leptin and ghrelin, which are associated with satiety and with appetite control. And with serotonin, somebody spoke about how serotonin is a mood elevator and can uplift the mood. This is high-intensity focused ultrasonic lipolysis, which is a non-invasive procedure, causes permanent fat reduction of subcutaneous cells, and it's a US FDA-approved procedure. It causes cavitation of the subdermal adipocytes. Physical exercise, yoga, of course, and brisk walking, we spoke about it, at least 30 minutes of activity every day, and 3 times in a week, resistance training. In yoga, we follow Patanjali's Ashtanga Yoga. Nutritional counseling and diet, of course, we all know that fried foods, fatty foods should be avoided, more vegetables and more of a DASH diet should be included. Behavioral counseling can be given to patients. Most of the obese people are depressed and they feel very stressed out, and they suffer from lack of confidence and self-esteem. So neuro-linguistic programming, cognitive behavioral therapy can be used. So this is a one-stop solution, integrated medical weight loss program. With this, I've been able to achieve considerable weight loss in most of the patients over the past 3 years where I've been evaluated this treatment. And there's also an sufficient inch loss. Thank you so much for your time. Thank you very much.
Right on time, Dr. Patil. Yes, globesity is a very important issue, and all that kapha out there we really need to balance.